Taking a look at health news right now, a new study released in the Journal of the National Cancer Institute says eating a lot of oily fish or taking fish oil supplements could increase a man's risk of developing prostate cancer. It lists eating so many omega-3s is associated with a 43% risk for prostate cancer overall and a 71% risk in aggressive prostate cancer. So we're here talking with Dr. Mark Hong here to talk about the safe way to get the omega-3s into your system. And let's start off with the supplements here. It's what a lot of people tend to eat at home, and there are benefits. Let's not get away from the benefits.
Right. First of all, thanks for having me, Ryan.
Absolutely.
And, I wanted to mention that I went to the JNCI, that article, and kind of read through it. And I want to be very careful because this has gotten a lot of attention, kind of throwing a bomb into everybody's diet. Everyone's on fish oil.
I know, we've been talking about the benefits of fish oil for so long.
Exactly.
Okay.
And when I read the study myself, it's kind of like, I remember reading a study once that showed the amount of births in the United States going up, and also the number of storks going up. And that'd be like saying storks have brought the babies towards
right.
We know that they were associated, but we don't know that that's what was causing the babies to show up. And this is the same exact study. So we have an association here of people who had high levels of omega-3 fatty acid in their blood levels. However, that doesn't mean that that caused the prostate cancer, and this is something we certainly need to investigate further. So at this point, I would have to say the scientific evidence here on this particular study is actually quite weak.
Okay. Still questionable is what you're getting at. When you take supplements, I mean, do you follow what it says on the back, or do you actually reduce that to something less? Your recommendation? Well,
of course, everybody is individualized. That's why you do want to come in and see one of us to discuss this. However, omega-3 fatty acids has really been studied on a lot of different levels, mostly that for cardiovascular health, lowering your cholesterol levels, and a whole host of other things. Now, in terms of cancer prevention, that's a little bit controversial.
Okay.
And so the amounts of omega-3 fatty acid kind of depend on why you might want to use it. For heart-healthy use, you kind of need to get a little bit more of it than what you would normally do for other reasons.
When should you move to supplements? We also brought out some natural items out here that give you the omega-3 fatty acids as well. How much is enough of this so that you don't have to turn to something like this?
Right. We all know that this side is easier to do, but this side is actually probably more natural as far as the definition of that is concerned. Supplements themselves, they range in quality, they range in effectiveness, how much of the actual stuff is in the pill, and that is not actually very well regulated. So my advice usually to my patients is stick with the natural stuff if you can. And it turns out that our bodies actually absorb omega-3 fatty acid better from natural sources than from supplements.
Oh, that's interesting. And what are we taking a look at? We've got, looks like some almonds.
Exactly. So here,
walnuts.
We got walnuts. We got edamame, which is soybeans. We got salmon here. And salmon is one of our richest sources of omega-3 fatty acids. Salmon and other cold water fish. Such as sardines. I know that's a bit of a tough sell, but salmon, even tuna, herring, they have omega-3 fatty acids. 2 servings of this a week, and this is actually
Is that a serving?
That is
the appropriate size?
About the appropriate size to get about half your daily omega-3 fatty acid
See if
intake.
we can. Yeah, I'll put this bottle up next to this just to give you an idea. That's not that much.
It's really not that much, and of course, portion size is another thing that's been creeping up over the years. If you look at the standard portion size, and so that it's actually not a whole lot of salmon there. However, other ways to get some omega-3s are in some of the nuts, such as flaxseed, walnuts.
And this you could sprinkle into salads. You can
exactly. It doesn't take a whole lot, a couple teaspoons.
That's it.
That's right. Exactly.
And that supplement, that's enough for you.
Well, flaxseed is one of the most efficient ways to get omega-3 fatty acids. Now, the kind of omega-3 fatty acid is a little bit different than the one in salmon, so unless you're vegan, you may switch it up a bit. Of course, a little variety doesn't hurt for your palate as well.
Interesting. Good to know. And, of course, with anything, I mean, if you take too many of the supplements, you run into issues? I mean, immediate issues?
Well, yeah, first of all, you want to be a bit careful. You always want to be supervised, especially when you're taking supplements. For example, if you're taking too much omega-3, you may run into bleeding issues. If you're already on aspirin and, for example, you go in for a surgery, and I don't know about it as a surgeon, I need to know that kind of thing. So these are things that should be supervised.
Dr. Hong, thank you very much for coming in here and talking about this.
Thank you.